Welcome back to Taking Charge of My Cancer podcast, episode 62. So join me today is Dr. Alexandra DiLeo, and she is a radiation oncologist here at UF Gainesville. She's original from Miami. She did her undergrad school at Harvard College and medical school and her residency program here at UF College of Medicine. Her disease site specialties are brain and spine, and her academic interest is medical education. She enjoys running, currently training for a marathon, watching TV, reading, spending time with her husband, Ned, and playing with her dog, Wooly. So thank you so much, Dr. DeLeo, for being with me today.
Of course. Thank you so much for having me.
Yes. So I think I met you when you were a resident.
Yes,
Uh,
which was very recently. It's my first year of being a faculty member, which I'm really excited about.
But it is not really recently because I met you when I teach the new residents coming in about what physical therapy can do for what a patient is in radiation. So I remember that was just yesterday when I was kind of meet you for the first time and kind of like teaching the new residents like the stuff that physical therapy can do while your patients are going through radiation. And just happened to be was like a year ago, but that was what, 3 years
I
ago,
know
4
you're
years
right.
ago?
Oh, it's like, yes, 6 years ago, I think by now.
6 years ago. Oh my God. That made me feel old. So, so since the beginning, sometimes it's hard to get a vibe just for doing a lecture, right? One time of teaching, but how much you guys engage, kind of like give you an idea. Not necessarily, I don't know if I want to judge, a resident life for just meeting them the first time and teaching them a lecture about like, oh, this person is going to be great versus not. But just your engagement and just you with patients and just how much patients really love you and the time that you spend with them and the quality of time you spend with them. I think that's one of the reasons why you are an attendant now, right? Because we want to
Oh, thank you.
get
That
in
really
there.
means a lot.
But even now, it's really nice to see that kind of relationship. It's not just the physician, right? It's just beyond that. So I really appreciate all the work you do for the patients. They really enjoy having you really as their physician. So that's what they keep
Thank you.
telling
And
me.
I can't say, enough good things about you and the entire physical therapy department. And I think because we work so closely and see patients at the same time, that it just really has improved the experience, for me, but especially for the patients. And so ditto.
Awesome. Thank you. So you want to tell me a little bit about what your mission, were you always planning to be a radiation oncologist?
Definitely not. I feel like I was in the same boat as a lot of patients or people even that go into medicine, that I had not heard of radiation oncology before medical school. I think I had always been on the track of going to medicine. I've been interested since I was at least in high school, though in the back of my mind, I thought I would maybe end up as being a math teacher, but I really liked science and I wanted to incorporate teaching into my career, and I wanted to help people, of course. And so that led me down the path to going to medical school. But definitely radiation oncology was not on my radar. And it was such a pleasant surprise to really find it in about the middle of medical school. And as you mentioned, I went to medical school here at the University of Florida, and we have a wonderful, in my opinion, a wonderful department that I was introduced to. And it was actually funny because my husband, who was also in my med school class, is the person who first found the department. And for various reasons, he really likes to spend more time within the hospital instead of in an outpatient setting. But he thought that it would be a really good fit for me. And it absolutely was. It was, it's such a special field. And because it's small, I think a lot of people don't know a lot about it, but it's a meaningful way to interact with patients and help people and through some of the toughest times of their life. So I'm really happy that I found it, but no, I did not expect to become a radiation oncologist.
Okay. Why make you drive towards treating the brain and the spine?
So yes, I treat brain, spine, and lung tumors. And Mostly when I'm deciding, like last year when I was looking for a position, my main priority was to stay, well, number one here. I wanted more than anything to stay here in the same department and at the University of Florida. But besides that, I really wanted to be part of an academic center and a university because I really love medical education and I wanted to keep working with learners. In terms of what sites to treat, there were a number of sites that I was really interested in, different types of cancers, but I'm very glad to be treating patients that have brain tumors and lung tumors because, they can be some of the most serious and devastating types of cancers in these areas. And so I feel like I can make a really big difference. And even in situations where a cure may not be possible, I think that trying to help people through that difficult time of life, working with their families, helping with their pain is still really important and meaningful. And so that's a big reason for why I like focusing on these areas.
Got you. If you have three valuable tips that you learned through your journey as a physician, as a radiation oncology, and perhaps like things that you have been learning from the patients that you're treating, what that will be?
So one, I think it's really important for the patient to be as involved as possible with their own care. And that really involves asking all the questions that you can about your diagnosis, because that impacts the questions that you'll ask probably on Google when you walk out of the office. If it's a cancer diagnosis, not only what type of cancer, but really what stage is it, and any detail that that you can to understand what's going on with you. And then also about just the treatment plan in general. And the more active that people are in their care is, more meaningful. It gives them a lot of feeling empowered in terms of what they're going through, even in a time when you feel like you might not have a lot of control. So just asking questions and being involved, I think, would be the first thing. The second thing would be trying not to make too many judgments based on what you may have heard, either from relatives or from the internet. And I think that a lot of misinformation can be spread, and it's not necessarily intentional or on purpose, but just somebody's experience with a certain type of treatment can be completely different than your own, not just because you're two different people, but they might have had a different area that was treated when it comes to radiation, for example, or a different dose, or it's just sometimes hard to compare two different situations. And so trying to go through the experience on your own and figure out about your specific situation instead of totally dismissing or alternatively thinking that something is the greatest option when it might not be the best for you. And then the last thing, which I think is most important, and not just for cancer patients, but for any person in general, honestly, is trying to make sure that your wishes and how you would want, your care to be handled and what you would want to happen when you can't make decisions for yourself, trying to make those well known to not only your providers, but to your family members, to your trusted friends, whoever it is that you think will really respect your wishes, even appointing them legally as a decision maker if that can't happen. And I think that that's just part of the good communication of not just asking questions to understand what's going on, but also making it clear what you would want to happen so that we can, pursue that and follow that and respect that.
That is so important. And we don't think about that, right? Because we think we're going to be healthy forever. And
Right.
we feel like we don't need to worry about that because, I'm not old, I'm young, or I have kids, I'm going to have all that life ahead of me. So I don't need to do that. And then when you get hit with like a brain cancer diagnosed, right? Being young,
Right.
even being older, doesn't really matter, but you don't have those things ready. That's not the time to do that, right? Because number one, that doesn't become your priority right then, because now you're like
Right.
super scared that you are fighting for your life and then you're gonna die. And then that's the last thing. And then perhaps at that moment in time, I'm sure mainly with brain type of tumors, you're not 100% with it to really know exactly what you want, right? Because all these other influences can be happening. So I think that's super important to get all that going ahead of the game.
Exactly. And that's why I say it's advice that I would give to anyone if they ask about something medically related, is just making sure that either you express what you would want and have that written down, or at least having somebody that would know that and that would respect your wishes, because we don't have control over what's going to happen, today, tomorrow, and so it's just nice to be prepared.
Yeah, that's an excellent advice. How about your most painful lesson through this journey?
That's a really good question. And the first thing that pops into my head is an experience that I had right out of medical school. No matter how much you're trained for the situation, I feel like people have to go through the mistake, honestly, before they really know how to do this better. But the Breaking Bad news experience can be definitely difficult. For me, I was busy on the hospital floor, and I thought that this patient that I went in to go talk to and let them know that they had a cancer diagnosis confirmed, I thought that they had a lot of this information already explained to them before. And I sort of just jumped right into the conversation, trying to go from one room to the next to update them. And I could tell almost immediately by the look on their faces that they had no idea what I was talking about, and that this was a pretty big surprise. And even though they knew parts of what I was saying, that they weren't ready for what I was saying as much as I thought that they were. And so the lesson that I took from that was I really need to, one, slow down before I walk into any room, prepare myself and think about what I want to say and how I want to say it, but more importantly, make sure I have a good understanding of what a patient knows and has been told and what they've heard before I go into any of the conversation.
Mm-hmm. And I'm so glad, not glad that you experienced that, but I'm glad.
Right.
Yeah, but I'm glad that you're mentioning this, because sadly, as how the health system is coming now, where physicians just go, I'm not saying every physician, because I know a lot of people I work with are really amazing and taking the time to really slow down and talk to the patients. But how many other physicians come in the rooms, if they come in the room?
Mm-hmm.
I hear patients after patients telling me stories, not necessarily from this system, but other hospital systems, talking about, like, that doctors are just outside my room talking about me,
Right.
and they don't even come in to tell me what's going on. And this is the relatives trying to say, like, I remember this patient telling me, or like the relative of this patient saying, like, I have to come out and say, you better get here and talk to me and give me an update what's going on, because we have no idea what's happening. So it's just really sad that we become that, right? Like, it's just like one after the other, it's one chart after the other, versus a human being that have no idea, they're scared, family is scared, and really spend the time to really explain what's going on with them. And if we don't have answers, we don't have answers, but at least they know we're looking for the best possible answers, but you're spending the time to talk to them and explain to them a situation.
Exactly.
Yeah, so I'm kind of glad you mentioned that. And yeah, so we just only learn from those mistakes, because I can guarantee you from now on, you're spending all the time in the world sure that they have
Yeah.
all the answers, all the questions
And
answered.
the first thing out of my mouth is always something to ask them about what their understanding of the situation is.
Exactly. And it's even with us, we have this breast prospective surveillance program for breast cancer that you're aware of. And many times, they see the surgeon, they get the news they have breast cancer, and they see us within 2 weeks, which they're still in shock. And I'm sure that the surgeon mentioned and the nurse navigator mentioned about the risk of lymphedema and the reason why they come here to see us. But when the patient come in, like, at least 7 out of 10 times, it's like, I have no idea what I'm here. And I'm sure that they have heard, but it is so much information that comes to them that they really have a hard time remember everything, right? Because at that moment you have a cancer diagnosis, the first thing you're thinking, I'm gonna die, what's gonna happen with my family, my kids, if they have small kids, or if not, doesn't matter. And then it's just a lot of information that they really have a hard time processing. So if that just happened within 2 weeks, and they come in here, and that's the first thing I as well ask them is like, do you have any idea why you're here? And they're like, no, not really. I'm going to have surgery, but I really don't need physical therapy yet because I can move okay. And even sometimes similar situation with radiation, right? They don't have surgery and it's just a radiation case. And in the beginning, perhaps they're doing very well. They don't have any symptoms, but then it's like, I really have no idea. I'm moving fine. I don't have pain. I just know I have this cancer that they're going to radiate, but I'm fine now. I don't really see the point to see you. And after we explain the reasons and some of the effects and how can we mitigate some of those effects, they're like, oh my God, that makes all the sense in the world. So glad I came here from the beginning and work with you guys all the way through my radiation treatment. So even, sometimes it's just really for the audience, really as a patient, ask for questions or ask every question you have. If you don't get the answer, fight until you get the answer. And then for anybody who is either, physician, healthcare provider, therapist, again, try to really ask the patients that how much do you know about what's going on before you start moving on with all this information. So that's very important.
Yeah, people can only process a certain amount at a time, and it doesn't mean that they, like you said, haven't heard it before, but it may not have really sunken in, and that's okay. And that's why it's our job to ask them and make sure that we know what they know.
Exactly. That's exactly right. Is anything that you have that will be of value for our audience, and will you share that with us?
I think that's a lot of what we've covered, making sure that you make your wishes known, make clear what you do and do not want, because you don't have to follow the plan that others are making for you. In my opinion, my job is to express what the recommendation is, what, would be the best option in your particular situation. But that doesn't mean that you have to follow it or that I expect you to follow it. And my goal is just to help you as best as I can. And that looks different for every person. And so it's not just the asking questions, but making clear what you want.
So if I want to go more in depth a little bit about, let's talk about brain tumors. So if you want to kind of give a little bit to the audience an idea, what is your role as a radiation oncologist in general? I know every patient is a little bit different, but in general, how do you manage brain cancer from the radiation oncologist standpoint?
So that's a great question, because I think that our relationship with patients depends on how many other people that they're seeing, if it's just us or if it's also the surgeon or a medical oncologist and neuro-oncologist. And a lot of the time, we can kind of be the silent partner, but and when I say that, I mean, you might be more likely to see the medical oncologist more often for chemotherapy than us. But anyway, in brain tumors, the common situation is that they would first undergo surgery with a neurosurgeon to take the tumor out, if it's a tumor that started in the brain. And a lot of times that can be symptomatic, and that's how they found out that they had a tumor in the brain. And so doing surgery, which is a very scary experience to have brain surgery, but it can help with a lot of the symptoms. And then depending on what they see under the microscope when they examine that tumor, a lot of times radiation can come after that to try to add a therapy to lower the chance that that tumor comes back in that area. And radiation therapy can be a daily experience, Monday through Friday, once a day for several weeks, like 6 weeks of treatment. And everybody's schedule is different depending on where their tumor started, in the breast, in the brain, in the lung, and how many other places in the body it might be. But for brain tumors, it's common for that to be a daily Monday through Friday for 6 weeks of treatment. And so we see our patients at least once a week while they're getting radiation treatment to see how they're doing symptomatically and let them know that the radiation treatments are going as planned. Here at UF, a lot of times the neuro-oncologist, who's the provider that will give chemotherapy, since chemotherapy as a pill is given a lot of times for brain tumors at the same time as radiation, usually will direct any sort of surveillance, which would mean visits to follow up afterwards and see how patients are doing and any new scans that need to be done. And so we might see patients on an as-needed basis. So that's one example where the radiation oncologist, or me, is somebody that you might see as a patient during the radiation treatments and then only as needed afterwards, and then having a different provider be kind of the main follow-up person. That being said, there's a lot of other types of tumors where radiation might be the main form of treatment. And then I would see patients during their course of radiation and then on a regular basis every few months while I'm ordering those scans and seeing how they're doing. So, and the reason for that is because, at least in my opinion, try to minimize for patients how many doctor's visits they have to go to. And so if they already have to keep seeing somebody to get more chemotherapy and medicines, I try not to add on to the visits that are already happening if I can.
Got you. Something I learned years ago with Dr. Amdur about tumoritis. So will you explain a little bit about that?
Say it again.
Tumoritis. You know,
Tumoritis?
Yeah.
You mean like inflammation of a tumor during radiation?
Yes.
Okay, so during radiation treatment, or actually before, I guess, when you're talking to a patient and consenting them for what they're going to experience, I usually split up side effects and toxicity into acute, or what can happen during the course of radiation treatment or in the couple of weeks after, versus late side effects and toxicity and what can potentially be permanent and start happening months to years after the radiation is over. In terms of acute toxicity, radiation can cause inflammation of the tumor and the area around the tumor, wherever it is in the body. And so when describing what side effects people can have, most of the side effects are related to which part of the body is getting radiation treatment and inflammation of that area. And so, for example, in the lung, it's possible to cause inflammation in the lung tissue around it. And so some people might experience coughing or issues breathing. And this doesn't happen to everybody, but at least that idea of inflammation around the area that's getting radiation can help you to think about what's going on and why you might be experiencing certain side effects during radiation. And usually it's temporary and it might not stop completely right after the radiation is done. It could last for longer. It might need to be treated with medicines to decrease the inflammation, even something like steroids. But usually these are temporary side effects.
Okay, perfect. How about on the spine? So would you be able to kind of explain the audience, again, if you just have, a tumor on the spine, either the difference on duration from actually treating an active tumor on the spinal cord, or the bone versus a bone metastasis, right? Because it's a little bit different how you guys treat that. So,
right. So for the brain and the spine, tumors can either start in those areas, or more commonly, they can spread from other cancers to these places. And so, for example, if it were, I know you asked about the spine, but if it were a cancer that spread to the brain, it might be that instead of having surgery and then 6 weeks of radiation with a chemotherapy pill, that we might offer a high dose of radiation just with one single treatment. And then similarly, if it's a cancer that has spread to the bone and the spine, first we worry about how big that tumor is and what it's pressing on and touching, and anything along the craniospinal axis, so within the brain or the spine, can affect your nerves. And so people might have seizures or weakness or numbness. And then we're always thinking about not even just what's going on in that moment, but what could happen if that tumor kept growing in that particular area. So for a cancer that has spread to the bone in the spine, there are multiple different factors that tell us how much radiation to give and how many days to give. So I can't give an exact number for what it is for every patient, but it can range from, again, one treatment. It can, be 2 weeks of treatment or more. And then tumors that happen within the spinal cord or the nerves itself are much less common than ones that go to the bone and the spine and then start to press on the nerves around it.
Okay, that's great. That's very valuable. Sometimes patients say, oh, I only have, 5 days of radiation. And so in the beginning, when I was learning more about what you guys were doing, it was like, oh, that's And they were like, that's so much better than 6 weeks. But sometimes
Right.
maybe that's not the reason, right? The reason is more, let's just treat it palliative pain management, those kind of things versus for a curative reason, right? So sometimes that kind
Right.
of a little bit of like, ooh, this is not as a good type of cancer as we want it to be if it's
Right.
just a short treatment like that. Great, that's amazing information. How can people find you?
Well, I'm located here at the University of Florida. I work in the Davis Cancer Pavilion. That's where you can find me.
Perfect. And I will write that information on the podcast notes. How about books that you would recommend for the audience and why?
Ooh, so I'm not the biggest book reader, but the ones that I do love that I did want to mention and share, I guess one for fun first. I I really get a kick out of Mindy Kaling. So any of her books are autobiographies. I think the first one that I read of hers was something like "Is Everyone Hanging Out Without Me?"
Uh-huh.
She's just really funny. So I think that that's a lighthearted read. In terms of medical related ones that I thought were really interesting and enjoyable, there is an autobiography called Between Two Kingdoms that a patient goes through her own personal experience of being diagnosed with leukemia at a really young age and what it was like to receive that diagnosis, to interrupt her whole life for treatment, what that experience was like, and then afterwards and beyond, trying to transition back into life. And it was really meaningful, I think, especially for me, mostly being on the other side of that, to kind of get this inside look into what a cancer patient's experience was like.
Mhm.
And the third one, so usually I read fiction books, but with, the exception that I just said, a biography that I really, really liked and that I think that is accessible to people even outside of science with the way that it was written, is called The Code Breaker. And it's about a scientist, Jennifer Doudna, I think her name is, and she won the Nobel Prize in Chemistry a few years ago, and she's involved in research on gene editing.
Okay.
And it really has so much potential in terms of treating a variety of illnesses that I think it's going to change our future, change our world. And so reading that biography and learning more about the work that she does, and then also the author goes into these ethical issues that we currently face regarding gene editing and that we could face in the future, depending on what they discover. It was a really, really great book.
Awesome. That's really good info. How about podcast?
Well, this one, of course.
Of course.
In terms of podcasts, I only listen to 3 podcasts, so I can only recommend 3 other podcasts besides this one. Their first 2 are news podcasts. So I listen to The Daily of the New York Times and Up First from NPR. And then the third one is also my lighthearted, more funny one. Daniel Tosh from the Tosh.0 show has one called Now the Tosh Show. So I get a kick out of that one while I'm on runs.
Great. That's good to know. Is any other question that actually, yes, I do have a question. Tell me about your marathon training. What is this? What's
Well,
going
as
on with
Durley knows, Durley doesn't just know me from here in the department in radiation oncology, but I personally am a patient of physical therapy. And I am a huge believer because of not only what I've seen that has been done in the patients that I treat, but also my own personal experience. So I'm a #1 PT fan.
Yay.
And in terms of my training, for a while over the last year, I was dealing with some hip pain that I started noticing after I ran a half marathon last year. And I started getting into running in general in college. I played soccer growing up, and then I was looking for a different activity. And I really fell in love with running. And I've gotten, a few aches and pains along the way, and knee pain here, hip pain here. And so last year, I started having this really aggravating hip pain that was not getting better. And I was nervous that I wouldn't be able to keep training and doing half marathons, which is what I really like to do. But I just knew that mobility and coming back to PT, and then of course working in the strength training exercises, even though usually I'm not the biggest fan of the gym, but I've learned to love it, has made a really has made a really big difference. And I have done one marathon before. I did it in medical school here in Gainesville, and I didn't think that I would do another one, but I think over the years since I've been running and then doing halves, I guess I've forgotten the PTSD of doing the first marathon, but also I just was ready, I think, to challenge myself with something again. And I didn't, and one, I was worried that with this pain, I wouldn't be able to do it. And thankfully I've been able to work out of it. But more importantly, I wanted to make sure that I was consistent with the exercises I was doing to not have it happen again and to stay stable and be able to do the running. And so physical therapy has been able to help me keep doing what I love, which I so appreciate. So
Awesome. Which marathon are you doing?
it's almost an excuse to travel to an area of the country that I really like. So it's in Oregon. There's no reason to go there except for I think it's beautiful, and I love the Pacific Northwest area and the landscape and nature there. And I am from Florida originally, so I'm not a person who's very good at running hills. So in part of my Google search of which are the flattest marathons in America, this one came up. So I kind of checked all the boxes.
So you're doing it in Oregon?
Yes,
Okay. When is the marathon?
in April.
Oh, wow. Coming close. Awesome. You'll do fine. You'll do great. Bless your heart. I did like a couple of a 9-mile run in Jacksonville when I used to live in Jacksonville.
Oh, right, the Gate River Run.
Yes, and then I thought I was gonna die afterwards. I don't think I can push more than that. And that was way before I have my kids. So I was like, I don't know, now maybe a 5K, maybe.
Exactly. And that's the other part is that I'm at the point in my life where I'm thinking about potentially starting a family. And so it's like almost like trying to achieve another athletic thing before going on to that
Yeah,
next step.
exactly. I think I did one before I have the kids, and I did another one after my second one. And oh boy, the difference was really a difference. I was like, I think I'm done. So
Yeah.
but I get excited for like having a plan of exercise in mind. And I really now one last question, and I let you go because I know you have plenty of things you gotta do. But did you have you know of any other places, or as you did your rotations when you go into your resident, any other programs where actually physical therapy see patients during radiation? How we do? Did you happen to see that in any other places, or you know of any other places who is part of we are so glad that actually we get an automatic referral. So when patient goes to see you guys for radiation, we see them right away, and then we triage the patients. If we need to continue seeing them, we will, and then we follow them throughout radiation and even after radiation. But have you seen any other programs who do the same thing in any other institutions?
I'm not sure, but in the few times that I have asked at other places, they weren't even sure what I was asking about in terms of having patients go to physical therapy throughout their treatment. So if I had to guess, I don't think that it's quite as integrated as it might be here.
Okay.
But I don't know the practice of a lot of different places. That being said, I think that most doctors and cancer providers will acknowledge how important it is to stay active as best as possible. And I think it's part of a lot of radiation oncologists, even speech, when they talk about radiation treatment, is one of the things that we say is that one of the side effects during treatment can be fatigue. But the more active that you stay during treatment, the less fatigue that you experience. And so to me, that kind of goes hand in hand with then the physical therapy part of it. But I don't know that a lot of other places have it as well integrated as we do.
Yes, yes. And I sometimes I see that. Sometimes, we even have, sometimes I come across some other institutions that are closer to us, and they don't even have a program where it's like an automatic referral happening. Like
Right.
we see them no matter what. And like I say, some of the patients we may don't need it at all, but we still kind of reinforcing some of the education that you guys do. And some of them is like, we are like the only light, you know, like they're going through all these treatments, the fatigue, the skin, the fibrosis, the lack of appetite. And they come here and then, you know, 45 minutes, an hour later, they leave like, oh my God, I'm so glad I make it. And so they really respond really well. So again, same thing for the audience out there. So if you're going through any treatments, talk to your physicians about have a referral for physical therapy and physical therapists out there. You should be able to get some, you know, training. Like I always say to my students who come here all the time, it's like, and they have no idea how to treat patients who had a diagnosis of cancer. But I always say, you know, this is your ortho patient, this is your neck, this is your shoulder, this is your brain, but just have the flavor of cancer on top. So you have to know about chemotherapy effects, radiation effects, and how can we mitigate those as much as we can. So really, it's not as scary as it is in the beginning when you don't know about it. But like you say, it's just amazing the amount of like outcomes you can get and how, you know, rewarding can be from patients as we making a difference in their lives, right? So it's really neat to see that. So
Yes.
it's not like it's not rewarding to see somebody like you from the ortho standpoint to be able to go and run a marathon with no hip pain. But I think it is very rewarding. But when we start looking at fighting your life and
No,
make
I
it
totally
better,
agree.
that really is, it just makes a difference. You know what I'm talking about because you deal with that every day.
Exactly.
Yes, yes. Well, thank you so much. I really appreciate you being with me this
Thank you.
afternoon. That was great information. I really appreciate it.
Thank you.
All right. You have a great afternoon.
You too.
Bye.
Bye.